what we learn, right? What's in the textbook definition of a normal menstrual flow in amount is 80 cc's of blood. So when you go to the doctor, that cup that they give you to urinate in for a sample is 100 cc's. So less than that cup, which people that have fibroids and bleed heavily will do that in the morning when they wake up.
Yeah.
Before I brush my teeth.
Yeah.
I've already done that much. And so Dr. Tang gave a very good presentation where you guys can see the uterus and see those fibroids. A lot of people have the misconception that with fibroids, it's the size that matters. More importantly, for fibroids, it's the location that matters. Location is going to speak to the symptomatology. Off the rip, when you said I have a fibroid that's in the middle of my uterus, meaning to me that it was very close to your endometrium, your cavity, I knew the very next part of your story was going to be, I have very heavy cycles, because that's what happens when it's close to the lining. You end up getting a disruption of the actual cavity in the lining of the uterus, what we call the endometrium. And then from that, you'll get very heavy bleeding, which can lead to your anemia. So your fibroids are very much directly associated with the anemia that you have. The other thing that Dr. Tang also had in her presentation are some of the medication options. And sometimes I think that we'll get caught up in what are my surgical interventions and miss that there is some reprieve, especially while you're trying to make up your mind, or you're waiting to get on a calendar, or you decided, but I'm a teacher and I want to do it in the fall when I have a break. Sometimes those medication options can be your reprieve in the meanwhile, or for me as a physician, because I want to put you in the best position to be healthy for that surgery, whichever intervention you choose, it can help relieve your anemia. It could either try to stop your cycle, try to slow down your cycle. Tranexamic acid is one that I think that a lot of patients have never even heard of when they come and see me as an option. Now, the truth of the matter is that it's not all or none. Some medications work very well for some people. Some medications won't work at all. Some medications will make their situation worse.